Hello, I'm Betsy Ross, and welcome to the Healthline program. November is American Diabetes Month, and the focus of this month's program as well. Dr. Linda Hermiller will help us understand what we should know about diabetes and how it can affect our overall health. And Nancy Anderson, a diabetes educator, will share self-management information about cooking and diet. That's all next and more on Healthline, presented by the Northern Kentucky Medical Society. The American Diabetes Association estimates that 20.8 million children and adults have this disease, but unfortunately 6.2 million of them are unaware that they have diabetes. And recently, the Kentucky Diabetes Prevention and Control Program reports that Kentucky ranks 7th in the U.S. with the largest percentage of adults diagnosed with this disease. Our first guest today, Dr. Linda Hermiller from the Northern Kentucky Center for Diabetes and Hormone Disorders, is here to shed some light on this disease that seems to affect so many in our community right now. Dr. Hermiller, thank you for being here. Welcome.
Thank you.
Big question I think that everybody has. We hear the term diabetes, but what exactly is it?
Diabetes is a disease involving abnormal management of sugar. Sugar being what our body turns the food we eat into sugar to burn it for fuel. And in diabetes, that process is abnormal.
We hear a lot about the different types of diabetes. Run through the types and explain a little bit about each one.
Sure. Type 1 diabetes, or what has traditionally been called juvenile diabetes, is a true loss of insulin production by the body. Type 2 diabetes, or traditionally adult onset diabetes, is more an issue of a resistance to that insulin that your body makes, or the body sort of forgets how to use it appropriately. There can also be gestational diabetes, which is a type of diabetes that is present during pregnancy and often resolves after pregnancy is over. And the final type would be pre-diabetes. These are the patients who do not quite meet the diagnosis criteria for diabetes, but do not have normal blood sugar management.
We mentioned that so many people who have diabetes don't realize they have diabetes. What are some of the symptoms that we should be watching for?
Symptoms of diabetes include excessive thirst, an increased appetite, frequent urination. There can also be changes in weight, particularly for type 1 patients. They can have uncontrolled weight loss. There can be significant fatigue or blurring of the vision.
So if you have a symptom, why do you not pay attention to it? Is it something that people, I think usually when we think something is wrong with us, it's going to go away. But if we have a symptom, why still are we unaware that we might have diabetes?
So many of the symptoms of diabetes can be confused with other conditions. They're very generic symptoms, and we do have the tendency to ignore things thinking they'll go away.
And sometimes they don't. So if you have a particular symptom, why or who should be more aware of it? Who may be more at risk for diabetes?
There are certain risk factors. People who have diabetes in their family are at increased risk of developing diabetes themselves. People who are overweight or obese, and people who have an inactive lifestyle. Those are all risk factors for diabetes.
So let's say we suspect that we may have diabetes. Hopefully we go to our doctor right away. What will our doctor do first round to diagnose this?
To diagnose diabetes, they'll do a fasting plasma glucose level, or they'll do an oral glucose tolerance test to measure your blood sugar at one of those 2 points. There's certain criteria that will then say if you have diabetes. Once you've been diagnosed, your doctor will do a physical exam, they'll take a pertinent history, they'll do some basic urine and blood tests to find out if there are any other problems that are going on, and then develop a treatment plan.
All right, before we talk a little bit about the treatment, let's talk about the testing. I think we see a lot of advertising about testing devices. Explain a little bit about some of the testing devices that are available now.
Absolutely. I have an example of a type of meter here. There are many on the market, as you mentioned. And the benefits we're getting from all the competition is that they're all getting better each time. Smaller devices that require less blood means less pain. So it's portable, it's easier to use. This is container that has the strips where the small drop of blood goes, and the meter that then measures and records your blood sugar. Doing this at home, as your physician directs you to, is important for you to see what your blood sugars are doing and how things you do in your daily life affect your blood sugars, but also sharing those numbers with your physician allows them to make treatment changes.
And how about different treatments?
There are several oral or pill form treatments for diabetes. We don't have any of those examples here today, but diabetes is a progressive disease, and at some point most patients with type 2 diabetes do eventually need insulin. Traditionally, insulin has been in the form of syringes and vials, and you draw up the insulin and you inject it. Newer developments are allowing us to make it more convenient, more user-friendly, more portable. This is an insulin pen device. Looks like a pen. Small needle is attached to the tip. The patient dials up how many units of insulin they've been instructed to take, and then simply depress the plunger to dose that insulin. You can take it with you, out to the restaurant, to work, however, so that you're taking your medication appropriately. For patients who are insulin requiring, particularly type 1 patients, there's also the insulin pump. Now this takes the shots out of the picture. It allows the patient to get a continuous infusion of insulin to dose their mealtime needs, but to get the continuous infusion without the shot.
And once you are being treated for diabetes, you really need a health team to help you get through this.
Absolutely. Diabetes doesn't just affect one part of the body. It's not just about the sugar. It's about the effects that it has on your vision, your heart, your nerves, your blood vessels. So you need a whole team taking care of you. Your doctor who's helping you manage your diabetes, a nutritionist, a diabetic educator. You need to see an eye doctor, possibly a foot doctor. Women need to continue to follow with their gynecologists. So it's a team approach to keep you as healthy as possible.
Well, Doctor, thank you for explaining this and really making us all aware of this disease that seems to hit so many of us here in our area. Thank you so much for being with us.
You're welcome.
And we'll be back with Medical Minutes right after this.
Are you looking for an exciting career opportunity in the dynamic communications industry? Do you have a sales, customer service, or technology background? If so, Insight invites you to check out our team today. Visit our website at www.insightcom.com for a list of all our open positions. Insight offers excellent benefits, including free cable and discounted internet. Email your resume to nkyjobs@insightcom.com or stop by our Florence office and fill out an application today.
A great soul ballad is something very special. It's so much more than just a song you sing. It's music that gets deep inside of you. And now you can check out the complete 10-CD Classic Soul Ballads collection for 30 days for just $9.95. Even better, when you use your credit card, you'll get free shipping and handling, a savings of nearly $15. So order now with your credit card, and for just $9.95, bring all 10 CDs, 144 hits into your home. If it isn't the best collection you've ever heard, just send it back and owe nothing more. The Classic Soul Ballad collection is, to say the least, very, very special. And I know you're going to love it as much as I do. I'm Peebo Bryson. Please enjoy the music.
Call 1-800-308-3900 for the Classic Soul Ballads. That's 1-800-308-3900. Call now.
Tune in to the sports page on ICN6. Each week, your host, Don Weber, brings you up to date with the latest in Northern Kentucky sports. From the Florence Freedom to Speedway races, from preseason workouts to the championship game, the sports page will bring you all the action on the field and behind the scenes. This isn't available with satellite. It's only available on the sports page daily on ICN6.
Welcome back. And now the Healthline Medical Minutes. Another flu season is upon us, and health officials agree that your best bet to avoid influenza is to get a flu shot. Thousands of people in the United States die from the flu, and many more are hospitalized each year. As reported on MayoClinic.com, A flu vaccine is between 70% and 90% effective. And for those few who might get the flu after being vaccinated, well, it will be a milder form of the illness. You do need to get a vaccination each year, though, because the strains of influenza change. The Centers for Disease Control and Prevention reports that there will be enough vaccine to meet the demands of those who wish to be vaccinated this year. So check with your family doctor on whether you and your family members should be getting a flu shot. And remember, wash your hands often, avoid touching your eyes, nose, and mouth, and avoid crowds when the flu season is at its peak. Now, for many of us, October and November are opportunities to enjoy the beautiful fall colors. But for some, the falling leaves mean a source of increased allergies. The Academy of Allergy, Asthma, and Immunology offers this advice on how to avoid the allergy triggers during the fall season. First, don't mow your lawn or rake the leaves. Now that stirs up the pollens and molds. Also, avoid being outdoors where leaves are being burned. And check daily pollen counts. Remember, stay indoors if those counts are high. And here's an important reminder from the National Jewish Medical Research Foundation. Never store your medications in the bathroom, near a stove, in a locker, or even in your car. The extreme temperatures and humidity can change the effectiveness of your medications. And in some cases, when improperly stored, they might even become dangerous. That's the Medical Minutes for this edition of Healthline, and we'll be right back with more right after this break.
I'm Patrick Crowley. I've been covering news and politics in Northern Kentucky for over 2 decades. I'm the political writer for the Kentucky Inquirer and host of On the Record on ICN6. Every week I find out what's going on behind the news from the people making the news. The governor, congressmen, city officials, county officials, controversial figures, business leaders. There's nothing off the record when they're on the record.
Well, I can't walk.
I can walk, but not very far.
I can't even stand anymore, and it gave me no freedom.
If you or a loved one suffer from limited mobility, we have incredible news. Now you may qualify for your very own new Invacare power chair or scooter at little or no cost to you. Call Mobility Products Unlimited right now to begin your free pre-qualification process. Invacare's powered mobility products are comfortable, stylish, easy to maneuver, and go anywhere.
And yes, you can get back out there too with Invacare.
So pick up the phone and call Mobility Products right now, risk-free. Their friendly specialists handle all the paperwork and make it fast and easy to begin the pre-qualification process for your very own Invacare power chair or scooter. You could get yours within just days. There's no pressure, no obligation, no cost for the call. And your satisfaction is guaranteed.
So call 1-800-913-5854 right now. That's 1-800-913-5854. Friendly mobility specialists are standing by.
The Milson Walker Financial Group, full-service financial advisors, can be seen each weekday morning on the chat room on ICN6. Tune in as Robert Walker or Barry Milson talk about the current ups and downs of the stock market, as well as financial news from around the world and what it may mean to you. The Stock Market Report from Milson Walker Financial Group can be seen Monday through Friday on the chat room, 10:25 a.m. on ICN6.
As we mentioned at the top of the program, November is American Diabetes Month, and our next guest, Nancy Anderson, is the Diabetes Education Program Coordinator at the Northern Kentucky Center for Diabetes and Hormone Disorders. Welcome, Nancy.
Hi, Betsy.
Big title. What exactly does that mean? What do you do?
Well, I'm in charge of coordinating a program for people when they get diabetes. They come in and they learn self-management techniques.
For example?
For example, when they come in, we might teach them how to deliver their insulin or how to check their blood sugar level. But most importantly, people come in wanting to know, what can I eat? So that's what we do.
So that's one thing that we really want to talk about here. What can you eat? What cannot eat? You cannot eat. Some of the things that a lot of people are concerned about are portions. How much can I eat? And you have some examples here of really the sizes that we should be eating.
Some practical tips that we try to employ when teaching people is what people with diabetes eat is the portions that anyone can eat. Portions come from the snack pack pudding size would be a half of a cup, and everyone knows what that looks like. A baked potato at Wendy's, for instance, might fit in that snack pack pudding 3 or 4 times, and the person needs to know then that they've used 3 or 4 carbohydrate servings. Other carbohydrates, and carbohydrates are the nutrient that most directly affects the blood sugar. The carbohydrates come not only from starches, but from milk and yogurt, fruit, and also sweets.
And you have here the apple next to the tennis ball, just showing the size that we really should be eating.
That's the analogy. The tennis ball size is 1 carbohydrate serving. So if a person chooses to eat an apple that perhaps came from a Christmas basket and it's 2 times that big, that's fine, but they realize that they've used 2 carbohydrate servings.
Of course, I think one of the most important things, or the things that are on top of most people's minds when they have someone in the household who has been diagnosed with diabetes, or they themselves have diabetes, what can I eat? What can I not eat? What portions can I eat? How can I change recipes? What are some of the modifications that you recommend?
Okay, the changes that we're going to talk about today are good for the whole family. A simple way to look at it is you can take any recipe and modify it by reducing the fat and the sugar by 1/3 and still have a very good product. The product today is our pasta salad. We've also taken the pasta, and instead of using the regular white pasta that you find in the grocery store, we've used one of the lower carb, higher fiber varieties. We've also made a vinaigrette dressing made with olive oil. And olive oil is a heart healthy monounsaturated fat. We've also reduced it by 1/3 though to keep the calories lower. Another modification we made was with the cheese. The original recipe called for 8 ounces of Asiago cheese. We reduced that by 4 ounces and are using 4 ounces of part skim mozzarella cheese. We've removed salami and pepperoni, which make it taste good, but they're very high in saturated fat. We've omitted those ingredients, and we've added a nice variety of dried beans. Dried beans give the salad wonderful texture, increase it by manyfold in fiber, especially when we use the black beans. The black beans are particularly high in fiber. So we add those, and then the fresh vegetables. In this case, we have green pepper, red pepper, and tomato. You can use an abundance of those, as much as you want. We teach people go for it when we talk about fresh vegetables.
So these are all things that all of us should be eating more of, frankly.
Correct.
All right, so let's start throwing this all together. Let's make the pasta salad. And while we're doing this, of course, here we're making it ourselves, and so we can control what goes in it and what doesn't go in it. But what about when you go out to eat? Are you afraid now that maybe you can't go out to eat anymore because you don't know what's in it?
That's probably the most frequent question that we hear. Everybody goes out to eat, it seems, in the hectic lifestyle. Many of the restaurants are cooperating by offering healthy alternatives. Look for specific labels on the menu items. For instance, sometimes there's a little heart or there's a reduced calorie label. You can also ask for specifics, like asking your dressing and your margarines or butter sauces or whatever, gravies on the side, and that way you still can enjoy that flavor, but you get less of it.
And that's no problem when you go into a restaurant. They will
most will accommodate you. The other thing you can do is when you get your serving, if it's larger than the portions that we're talking about, you can ask them to bring you a take-home container right away and portion out what you get, and that way you get 2 for 1 as far as your dining out goes.
You get breakfast and dinner for the next day, too. Why don't you go ahead and throw in that and throw in the cheese, and we'll be really brave and taste a little bit of this as well. But you make it sound so simple just to swap out the different ingredients. It doesn't seem like it's that big of a modification once you get into the recipe.
No, and the flavor is still there. And actually, in this recipe, we've gone from one serving being over 450 calories to 300, and have gone from 58% fat to 30% fat, which is the American Heart Association recommendation.
Oh, that's awesome for everybody. Well, we are going to try this. Nancy, thank you so much for bringing in this wonderful pasta salad. And boy, when you look at it, it's even Pretty. Isn't that beautiful?
Thank you.
There, we'll let you try some, and we'll try some as well. And by the way, if you want to try this recipe, you can go on our website. We will have the recipe there. You can try it out for yourself. Nancy, thank you so much for being with us. How is it?
It's excellent.
Is it? All right, we will try it. And we'll be back right after this.
Are you looking for an exciting career opportunity in the dynamic communications industry? Do you have a sales, customer service, or technology background? If so, Insight invites you to check out our team today. Visit our website at www.insightcom.com for a list of all our open positions. Insight offers excellent benefits, including free cable and discounted internet. Email your resume to nkyjobs@insightcom.com or stop by our Florence office and fill out an application today.
You're stuck on a treadmill. You're making minimum payments on your credit cards, and you just don't get anywhere. Let Consolidated Credit tell you the truth. When credit card companies are charging high interest, it's virtually impossible to pay off your debt. Let's say you owe $5,000 and your rate is 21%. Of your $100 minimum payment, $87 is interest. It'll take you over 33 years to pay off that debt. Call Consolidated Credit. They'll get the credit card companies to reduce or eliminate your interest. Get off the treadmill. Get on with your life. Call Consolidated Credit. They're the freedom people.
Call now. 1-800-530-5706. 530-5706.
Consolidated Credit. When credit card debt is the problem, they're the solution.
Miss a minute in Hollywood. Who's with who, wearing what?
E-News wants to hook you up.
Come on, you don't want to hear the latest headlines from your friend. You want the latest first.
So we're going to give you 2 chances to watch E-News weeknights at 7 and 11.
So what's happening as we speak?
A lot.
Want more? Watch E-News weeknights at 7 and 11 Eastern and Pacific. We love it too.
E-News weeknights at 7 and 11 only on E! Insight Channel 64.
Our House Calls segment gives you, the viewer, an opportunity to ask questions about your own medical concerns. We have doctors from the Northern Kentucky Medical Society ready to answer your questions. Our first question comes from Ann in Fort Mitchell. The flu season will soon be upon us, and I want to protect my family if I can. What age children should be getting flu shots? We asked Dr. Lisa Miller to answer this question.
And I'm glad to hear that you're interested in preventing the flu. I wish all parents would think about that this time of year. The government has divided children into 3 groups for who should get the flu vaccine. The first priority is all children ages 6 months to 5 years, and children who have asthma, diabetes, chronic heart conditions, children who take asthma every day, or children who take aspirin every day, children who have other medical problems. All these children should get the flu vaccine. The second group would be all the siblings of these children, and then the third group would be anybody who doesn't want to catch the flu. A few people should not get the vaccine. That would be children under 6 months, children who are allergic to eggs or have had an allergic reaction to the flu vaccine before, children who've been on high-dose steroids, or children with cancer or other immune problems. So you see, most parents should bring their children in to get a flu vaccine.
Dr. Bill Monning answers this question from Andy in Florence. I have recently read that it is important to catch prostate cancer early. What kind of new tests are available to detect this type of cancer, and at what age should men begin to be tested?
Andy, you need to be evaluated if you're over the age of 50 on a yearly basis. We have blood tests that can help us decide whether you should be further evaluated. The blood test is called a PSA, and everyone should also have a rectal exam once a year to check on the prostate. There is a difference as to whether your family has a history of prostate cancer. If that's the case, you should start being tested at age 40. There are certain differences from one race to another. The African Americans also should start to be treated at age 40 and have annual tests. So you need to see either your family doctor or a urologist to get those kind of tests done.
And our final question comes from Richard in Newport. If I have to go to the emergency room for an illness, what should we remember to bring along to make it easier for the doctor to treat me? We went to ER physician Dr. Patrick Beerer for this answer.
One of the most important things would be to bring all of your medicines with you, or an up-to-date complete list of all of your medicines and doses and the times you take them. And if you've had any medicines prescribed to you recently that might have finished, for instance an antibiotic, we'd like to know that. We'd like to know any drug allergies and what that allergy is specifically. If you're being seen at the hospital for a spell, such as a seizure or something like that, we'd like to talk to an eyewitness who could help us with the history. And if you don't speak fluent English, it'd be helpful to bring a close relative or friend with you who speaks English. But don't let that delay come into the hospital. We can always get an interpreter.
And our thanks to Dr. Lisa Miller, Dr. Bill Monning, and Dr. Patrick Beerer for their professional medical advice. Well, we are out of time on this edition of Healthline. We, of course, would like to thank all of our guests, Dr. Linda Hermiller and Nancy Anderson. Now, if you missed some of the information listed on today's program, or maybe you have a question that you would like answered in our House Call segment, be sure to go to the Northern Kentucky Medical Society website. Then click on the Healthline button. All of our program information is listed there, and you can email your questions to us. Each Healthline program will air numerous times each month, so make sure you check the listings for the days and the times it will be on. We hope you will join us again next month for a new program where we talk about those medical issues that will help keep you and your family healthy. Goodbye for now. I'm Betsy Ross. This has been Healthline, presented by the Northern Kentucky Medical Society.
Weeknights, Debbie, Sal, and Kat deliver the Daily 10.
Hollywood Buzz, before it starts buzzing, we'll loop you in.
Must-haves of the moment, we got it now.
Celebrities out and about, we got the snaps. Celebrity spin, 10 at a time.
You won't know what hits.
The Daily 10, weeknights at 7:30 and 11:30 Eastern and Pacific, only on E! We love it too.
Only on E! Insight Channel 64.
Well, I can't walk.
If you or a loved one suffer from limited mobility, we have incredible news. Now you may qualify for your very own new Invacare power chair or scooter at little or no cost to you. Call Mobility Products Unlimited right now to begin your free pre-qualification process.
And yes, you can get back out there too with Invacare.
So call now risk-free. Friendly mobility specialists handle all the paperwork. You could get your Invacare power chair or scooter within just days.
Call 1-800-621-5072.
Hi, I'm Jackie Shear, the host for Job Connections on ICN6. The Bank of Kentucky sponsors this weekly look at job openings in Northern Kentucky. Each week, we feature 3 guests who highlight the current openings they have available. One constant is the Kentucky Office of Employment and Training. Every program has an employment specialist discussing real job openings. Job Connections Daily, only on ICN6.
I'm Patrick Crowley. I've been covering news and politics in Northern Kentucky for over 2 decades. I'm the political writer for the Kentucky Inquirer and host of On the Record on ICN6. Every week I find out what's going on behind the news from the people making the news. The governor, congressmen, city officials, county officials, controversial figures, business leaders. There's nothing off the record when they're on the record.